guys, welcome to week 3 overview. Just really quickly, if you have students that have not submitted their week 1 makeup work, could you please email Mary Claire? Alternatively as well, if you have students that have not attended either weeks 1 or 2, could you please email Mary Claire? We both are meeting at midday on Monday and we are going to be sending out emails to those students. So we do need to know what's going on with them. The other thing this week, of course, is the students have to have submitted or shown you. It can be a hard copy, it can be on their phones or their laptops, but they need to have shown you their hand hygiene certificate. We have a column on Grade Center that you can tick into when you look at that hand hygiene certificate. As far as the workplace health and safety module for down here, they do think they can fix it, but they've got to go find the original, upload it, So I'll keep you, don't worry about that at the moment. And if students, I keep telling the students, just hold off, don't worry about it at the moment. Excuse me, I'm going to look at my notes because this week is really important. Something I need to tell you after those girls infested people the other day or infected people the other day, we did get a lot of calls from students that live in the various areas where the girls had been. So you probably noticed more students away on Thursday, Friday, and that was because we did get them to stay home and we asked them to be COVID tested and they're sending me results now. I will flick you into an email when they send me their results. I send them the makeup work and just ask them if they could do it towards the end of next week. So if you've got any queries about that, just ask me. We're trying to be very safe with all of that. Now, this week is all about manual handling, and we have to remember with manual handling that the students in fact could hurt themselves down here if they don't think about the theory and apply it to when we're doing the practice. So just constantly remind them to be safe. So maybe go over with them the spine in the nice S shape, to deep abdominal brace, the weight transfer technique, get as close to the load as possible, nose and toes in the same direction, so no twisting. If you could remind them to go through all of that when they're doing the various tasks. So we really divide it up into able to assist and not able to assist. So able to assist is those patients who have some mobility and can understand verbal instructions. So it could be as simple as we stand in the room and give instructions, they'd be entirely independent, or we give instructions with or without lifting equipment. Minimum 1 staff member and a trained staff member. So that would be an employee of the healthcare facility as well as our student. When it comes to unable to assist, so that's a different story. Most of the facilities now, the nursing homes, will insist that 2 trained staff be available plus our student. So could you just encourage the students to ask at orientation when they're given their manual handling talk, which they are, and they go through the equipment with them, if you could just encourage the students to ask what the policy is there. So what I might do now is just take you through what they have set up for us for week 3. So there's a variety of mobility equipment. If you could just go through that with the students, I think that's really important. And if they have some downtime, they can have a little bit of a play with it. Oh guys, I probably should show you in each room, there will be charges for the hoists. So we have the patient hoist here, the Joey, the sling hoist, and we have a standing hoist. So you may have to find that you need to recharge in between your classes. Now, as far as this hoist is concerned, definitely minimum 2 staff, and I think you'll find it's minimum 2 trained staff plus our student. But of course, they need to look at the care plan and the manual handling risk assessment form, because generally it depends on the weight of the person and what's on the floor as to how many staff have to be present when this hoist is used. If you could go through the hoist with them, you know, going through with them to check for weight, that they check that it goes up and down, that it's all working correctly, brakes, that kind of thing, and show them the different hoists. of the different slings. So this one is a shower sling, and this one is more a sling just if we're getting them in or out of bed. If you could explain the different sizing and link it to the sizing on here, that would be great. As well as please show them how to measure for the sling. So that should go above the head, so not like this, but above the head and to the top of the crack of the bottom, and explain the reasons for that. I'm sure you all know how to use hoists. I guess if you're not familiar with lifting equipment, you're more than welcome to email myself or Terry or anyone who is really familiar with using this equipment, and you could pop in and look at one of their classes because it is so very important. Coming over to the next station, excuse me, standing hoist. So with the standing hoist, I think it's really important that we let them know that this is just really to go from A to B. So maybe a chair to bed or bed to a commode. It's not a walking hoist, and we don't have a walking hoist here, but I talk about it in the lecture. So again, the same thing, go through all the safety and all the checks, explain the different size slings. What I do with both of the slings is I actually put students in them, and if you're fairly confident, stay close so when the guys are practicing all of this, but just make sure that they're doing the right thing and safe. So that's our standing hoist. Over here is able to assist. So this bed is set up so you can use the patient's body mechanics and bed mechanics. And the idea is this is an able to assist who just needs a bit of assistance, so a little bit of lifting equipment. So using the bed mechanics and the patient's body mechanics, remembering guys safety with, lifting the beds up and down, get the patient out of the bed and into a chair, and then show them rocking technique. And then when they get back into bed, using the leg lifts and the little trick with the slide sheet to get them back into bed. And then finally over there, actually it's really good because we have one slide sheet here. Of course, best practice now is to use 2 slide sheets. So maybe even at this bed, you could also do able to assist using the patient's body mechanics and bed mechanics for sliding up the bed. But also, sometimes it does require a piece of lifting equipment, which would be your slide sheet. Maybe show them using one slide sheet here, because I do know that best practice is 2 slide sheets, but very occasionally you'll find there's only one for various reasons. It's really important that they know how to use one. So perhaps that's where you could do that. And then finally over there will be I'll just walk over there, excuse me. This would be your unable to assist here. So what we will do here is we will use 2 slide sheets. So pop a student in the bed. Make sure both slide sheets, they go above the head and below the feet. Show them the correct stance, how to hold the top slide sheet, not the bottom slide sheet. Have another student beside you. Remember to lift. So up the bed, again, using bed mechanics, slide the student up the bed, but also here, unable to assist rolling the patient on this side. So 2 different techniques at this particular bed. That should cover the basics for them, but the whole time they're practicing this, if you could please remember to remind them about all the safety. The other thing is pat slides. If you have time after all of that, we have a pat slide in every room. You could show them, even though hover mats are probably more common nowadays, but because they're going to aged care facilities, they will have some pat slides, how to move a resident from one bed to another or a bed to a trolley. Just remember, if that's the case, you need 1 pat slide and a slide sheet, and have the bed that they're on higher, slightly higher than the bed they're going to. Please remember to put the brakes on both beds, and you'll need 3 or 4 or 5 students to assist you with that, depending on the size of the student. So if you've got time to do that, that would be great as well. This is a really busy class, so I think they will end up having to do progress notes themselves at home. and just remind them that I put the PowerPoint up at the end of the week. Thanks guys, enjoy your week. Oh, just really quickly there, I won't be doing a video for the mid-year entry students. I will just contact, I think I've got 4 teachers in week 4 doing the CPS for the mid-year entry students. I'll just speak with you and send you an email. It's a very skills-based class, so I'll just contact you. So there will be no video from me next week. Bye guys.